As I said, we're so glad you're here for this special conversation that could not possibly be more timely with your fellow donor of the foundation, Gretchen Sisson, who I will introduce momentarily. Just to give you an idea of how things are going to go in the next hour, I'm going to finish up my introduction, hand it over to Gretchen, who will help us understand all that's happening to threaten reproductive health and freedom. And then we'll open it up to you all, our audience, to ask Gretchen your questions. And we can make it super conversational, no need to be formal about it. And then you will leave this event with some clear action steps to take with your giving, including this fantastic give guide that Gretchen curated with her recommendations for where to give now. Before I go any further, I just want to acknowledge I am on unceded Ohlone land, specifically the western slope of Twin Peaks in San Francisco. At the foundation, we have a practice of doing a land acknowledgement. We do this in order to combat the erasure of Native people and the violence that they have faced and continue to face. If you know the Indigenous people whose land you're on, please go ahead and put their name in the chat. I know we're not all in the Bay Area and in different parts of the Bay. We may be on different Native land. We also have a great tool that if you don't know whose land you're on, it's in the chat now and it can help you find out. So, to the introduction of our guest, Dr. Gretchen Sisson. So Gretchen and her partner have a DAF at the San Francisco Foundation, and she and I were emailing a few weeks ago, and she agreed to share her expertise with you all. Of course, we had no idea that there would actually be a Supreme Court hearing today, so this could not be more timely. So Gretchen's full bio, we're going to drop in the chat, but some highlights. Gretchen Sisson, PhD, is a sociologist who studies the social construction and representation of parenthood and reproductive decision-making. Her current research focuses on depictions of abortion in popular culture, which has been picked up by all the major news outlets. Gretchen's additional areas of research include adoption and birth motherhood, teen pregnancy, and young parenthood. She's currently working on a book about abortion within the context of abortion politics and the reproductive justice movement. Gretchen serves on a number of boards and is passionate about building the pipeline of Democratic women in elected office with the enduring goal of electing a woman to the White House. So Gretchen, thanks again for joining us and sharing your expertise at such a distressing and disturbing time for reproductive freedom. Of course, we had the hearing this morning, as well as the one a few weeks back about the case in Texas, which is, trying to ban abortion after 6 weeks. We know you've been working and funding in reproductive health for your entire career. And we're so glad to have you here to help us understand what is happening now. How can we mobilize philanthropic dollars to stem this tide, seeking to eliminate reproductive freedom? And I'll hand it over to you.
Great. Thank you. Ooh. Yes, I am unmuted. Sorry about that. Thank you, Allie, and thank you everyone for joining today. Today is a really hard day. The oral arguments this morning were difficult to listen to, but it's also something that my colleagues and I have been preparing for a long time, really since Donald Trump was elected. We expected to lose the Supreme Court. We did. We lost it in a particularly painful way, given painful way emotionally, but also given the outlook for abortion rights and reproductive freedom. So my bio has a lot going on, but I am a research sociologist. I focus really primarily on abortion in the United States. So looking at cultural messaging and policy within the US. And we're part of the OBGYN department at the university. And my colleagues are multidisciplinary, so they include demographers, epidemiologists, physicians, nurses, public health scholars. So it's a really exciting place to work, where we're really looking at what abortion care in this country looks like comprehensively. I'm not a legal scholar though, but I am going to give you kind of a rough sense of what happened in the court this morning, what case they were hearing, what we expect is going to happen, and then what I have been doing with my own philanthropy and what I am suggesting others and you can do in thinking about how you might want to guide your own work and your own giving moving ahead. I think the biggest piece is that we expect that we will lose. There was nothing in the oral arguments today that suggests that that is not a pretty safe assumption. It's a question of how we lose and what that means. And there's a couple of different ways that can happen. And we can get into that in a moment. So the case before the court that was argued before the court today, it wasn't, some people think it was a Texas case. It actually wasn't the Texas SB8 case. The court has declined to hear the Texas AB8 case, which actually means that the Texas law has gone into effect. And the circuit court has basically said, we're going to wait to see what the Supreme Court says on this Mississippi case before we make a decision, another decision about this Texas law. So what you have happening is all of these cases that are at some point in the federal judiciary pipeline, that they're all kind of waiting or lined up or in limbo or tied to each other directly or indirectly, while everybody's sort of waiting to see what this new Supreme Court is going to do with this case, because they're just waiting to see if we have a court that's going to uphold Roe or not. So the case today is Dobbs versus Jackson's Women's Health. It's out of Mississippi. It's a 15-week ban, gestational age ban, essentially. And it is actually the first case before the Supreme Court to directly challenge Roe v. Wade. It's the first case to ask the court to overturn Roe. And we do not have the court. We do not have the court at all. It is a 6-3 court, and several justices have been on the record as in favor of overturning the precedent of Roe, and a few are in favor of upholding that precedent, and a few we do not have on the record, but they are, it is clearly not something that their previous jurisprudence would suggest that they are in favor of doing, and it is not something that their questions this morning in the oral arguments indicate that they are inclined to do. We will probably know the court's ruling in June. The court usually issues their kind of more controversial opinions later in June. My birthday is June 29th. I got gay marriage on my birthday. I got the whole women's health decision on my birthday. I think I might lose this one on my birthday. So we'll see what happens with that one, but we will probably know the end of June. The Louisiana has actually a very similar law or case to this Mississippi case that is directly tied to this. So if this Mississippi law, which is actually not in effect, it's enjoined until this case is decided. If the Mississippi law is allowed to go into effect, the Louisiana law will immediately go into effect. And there are also cases on the docket from Kentucky, Missouri, Georgia, South Carolina, Arizona, and then this Texas SB8 law that are at least like somewhat tied. Some of them are directly tied, and then some of them are like a circuit court being like, let's wait and see what the Supreme Court does, and then we'll kind of know where we're standing and what interpretation of the Constitution this country is functioning under right now. And for states that don't like Oklahoma doesn't, as far as I know, and again, I'm not a legal scholar, so there might be a case out there that I'm not aware of. Oklahoma, I don't think doesn't have a case in the federal judicial system with some crazy abortion law. They will really quickly, right? If this Mississippi law is upheld, like Oklahoma will be right there. Their state legislature will be on the front line passing a pretty extreme restriction. So this list of states that I just ran off, these are not the only states that are going to be enacting pretty profound barriers. They're just the ones that are like teed up, ready to go right away. So other states will pretty rapidly follow suit. There are a couple of different things the court could do. The least likely right now, well, that's not true. One of the less likely ones, I think, is that they could uphold Roe, right? Maybe we're wrong. Maybe they will uphold this precedent, and they will overturn this law, and they will say, you cannot have pre-viability restrictions, and this is an undue burden, and no, and something like what the status quo will go on. And that would actually be meaningful, because it means that this court that we think we have lost, we haven't lost. And we would have the possibility of working with that, right? Like we could work with that, right? And we could see, and then they might, there's a number of different ways that could go. I don't think that that's likely to happen. They could uphold Roe and effectively overturn or gut a Supreme Court decision, a 2016 Supreme Court decision, Whole Women's Health, which effectively defined an undue burden standard. So I don't want to get too in the weeds on this, but you basically have Roe versus Wade, which said that the state can't limit pre-viability abortions. And then you had a Supreme Court case in the 1990s, Casey versus Planned Parenthood, that said, actually, a state can have an interest in limiting abortion, but it can't create an undue burden on the person who wants to have an abortion. But it never said, this is an undue burden. This is what counts as an undue burden, right? And so then states were like, well, we can put this restriction. That's not an undue burden. This restriction isn't an undue burden. This restriction isn't an undue burden. And it was very ambiguous what was an undue burden and what wasn't. In 2016, a lot of these Texas laws that were these trap laws, the Supreme Court at that point said, these are undue burdens. You cannot do this. What this court might do at this point is remove that and say, this isn't an undue burden, and once again, take us back to that kind of space of ambiguity around what is an undue burden and what isn't, and actually kind of go a bit further back than that, because if they allow the Mississippi law to be upheld, they're actually saying that it's a very high bar for what's undue, right? Like if a 15-week gestational age ban isn't an undue burden, then it has to be very extreme to be undue. So that they could do that too. And effectively what that does is it renders Roe v. Wade pretty meaningless without people realizing that's what they've done. My worry here is that we lose meaningful abortion access, but people don't realize that that's what's happened. And so the political backlash that would happen doesn't materialize. And so that's a messaging challenge, right? Because if we lose meaningful abortion access, which we know most Americans value, and we do not have that doesn't become a galvanizing moment for large portions of this country, then we've lost the fight. And that's the biggest risk, right? Is that we lose and nobody realizes that we've lost. One of the worst case scenarios is that the court could do something really extreme and come back with like a personhood decision, like something that essentially confers personhood rights to a pregnancy or a fetus. I don't think that will happen. That to me is the least likely scenario. It's also by far the worst case scenario, because then abortion is legal in the entire country immediately. There's no safe haven states. There's no border crossings. There's no IVF. There's no miscarriage management. I mean, it opens up just an absolute nightmare Pandora's box of other legal challenges as well, right? Like, if you are pregnant, then do you need 2 passports, right? If your pregnancy is another person, right? It's a mess. It would be an absolute mess. But the fact that it is a legal nightmare hasn't stopped like a number of states from like putting ballot measures about fetal personhood on their ballots. Like, and I think it's unlikely, but I don't think it's impossible. But I don't, it's not something that most legal scholars are seriously concerned about. I think it's more likely that we win than that we lose in that particularly concerning way, but that's a possibility. So those are the different ways that I could see it going. I also want, one other thing that I hear people kind of talk about a lot is the idea that like, if Roe is overturned either completely, right, and the court rules like thus Roe v. Wade is overturned, or in spirit in some way, that then it reverts to the states. And that's true unless Congress decides to act, right? So you can, like, Congress can always enact a gestational age ban itself, a federal gestational age ban. They could put in place a 20-week ban. They could put in place a 12-week ban. They could put in place a 6-week ban. And so it reverts to the states unless the federal government also decides to take action. And so this isn't entirely a state-based issue. It will be in the short term. But it's important to not think that this will no longer be a federal issue at all. And I also think that it is important to consider the ways in which illegal abortion will be very, very different than it was pre-Roe. So we have a lot of ideas about what illegal abortion looked like before Roe v. Wade, right? We have a lot of coat hanger imagery, a lot of these like back alley procedures. And I'm not trying to minimize how dangerous those abortions were. It's just not what illegal abortion provision is going to look like moving forward. It is not coat hangers, it is pills you buy on the internet, and they will be the same pills that your doctor would give you, and you can take them safely. And there has been research on this where researchers have gone out, they've bought pills online, they've assayed them, they've tested them, they've measured the doses to make sure they're the correct doses, they've seen where they're coming from, they've tested the messaging and the instructions around them. They have looked at counterindications and whether or not women can take them safely. And this is something that we know women can do safely. Actually, we know that women in low access states are already doing this safely. So this is something that makes a lot of people uncomfortable and very nervous, because this is not the standard of care that we want people in this country to have for their abortion access. But it's also something that we need to consider, because we are looking at a very precarious legal reality soon. And we need to not be relying on very outdated ideas about what illegal abortion looks like. And I think that that's important, because some of this messaging about the importance of legal abortion rests on the idea of illegal abortion as unsafe, right? Like, millions of women are going to die if this happens. But what if they don't, right? What if we can do this safely now without medical supervision? Because I think we can. It will be a criminal justice crisis if they're prosecuted for doing this. It will be unsafe for some women. It could be expensive. It could be abused. It could, like, I'm not saying it's good. I'm just saying that we can't tell everyone that this is going to be a public health crisis, because what happens if that doesn't materialize, right? We can't rely on kind of like a fear mongering sense of what this will look like, because that might not be the future that we're actually moving towards. And we know, and this isn't even just the future. Like, we've seen this in countries in Latin America where abortion is illegal, but mifepristone is available over the counter as an ulcer medication, right? Like, we know that women are already taking these pills on their own. Or like in countries like Poland or Northern Ireland, where it was illegal, and like they had drones like flying across the border with pills, right? Like, this seems like kind of science fiction in some ways, but like this is happening in a lot of parts of the world, and it will be happening here. So I just kind of want to challenge people to kind of push past some of those ideas about what illegal abortion looks like, and kind of reimagine what this is going to be like moving ahead. Also wanted to mention a few kind of like extra legal concerns, which is that clinics are going out of business. They're going out of business already because they are losing patients. And with gestational age limits, they are losing a portion of their patients, most of their patients, all of their patients, the patients that have the more expensive procedures that actually keep them in business. And you know, some of these clinics are nonprofits. They operate on very small margins. You know, a lot of them are mission motivated, but they're treating people that are, you know, don't have a ton of disposable income. They're relying on public insurance in the states that cover it, which is not many. They're paying out of pocket. They have to keep their costs low. So these clinics a lot of clinics are closing. They don't have time to wait for the Supreme Court to rule either to reopen them or not. And so that's a problem, because when they close, they're going to be closed forever. And so for some of these clinics, it's quite urgent that they get an influx of investment sooner rather than later if we want them to be open for patients at any point. The other thing that we need to think about is kind of the inverse problem, is while we have clinics that have no patients, and because of these restrictions or these limitations that don't allow them to care for the people right in their neighborhood, in their state, that need them, you have an overwhelm in the clinics that are in surrounding states. So for example, when we say things like a woman in Texas has to drive 8 hours to New Mexico to get an abortion, that's true. That clinic is 8 hours away. But if every woman in Texas is driving to that same clinic in New Mexico 8 hours away, that clinic does not have any availability, right? And so then she has to drive 2 hours further to get to the next one, right? And then that clinic is full. And then, you know, okay, well, all the clinics in New Mexico are full. Now we're flying to Chicago, right? And then now we're looking at Florida, and now we have longer wait times, and procedures get more expensive because they get more medically complicated as you increase gestational age. Well, now my procedure is more expensive, so now I need to come up with more money. Now I need to save more money. Now I need to, that's going to take me an extra few days. Now I need to reschedule, you know, so you end up in this kind of cycle. And so this is something that we also need to think about when we're investing in the infrastructure of our clinics around the states that we expect to be low access, and how we're going to care for those people who are traveling. And I think that there's a lot of opportunities for Californians, particularly there. And along those lines, you know, I think California, and not just California, there are a number of states that are going to have to be really exemplars for this country as far as what meaningful access looks like. And there's a lot of good in California, right? California has pretty good access laws, but not like amazing, right? Like if you're in the Central Valley and you need an abortion, like you still have to travel kind of far, right? Like it's not great. We don't have a ton of providers there. We do have laws in the books that allow nurse midwives and nurse practitioners to perform medication abortions. Which has greatly increased our number of providers, but they're still concentrated in urban areas. there is work to be done there. A lot of my colleagues are working on that. We dramatically need to increase our our Medi-Cal reimbursement rates for abortions. And this again goes back to the need for our clinics to be financially solvent. So if a Planned Parenthood is losing money every time they do an abortion, that's really hard work. That's why they are so reliant on philanthropy and donations to keep their doors open. If we could just get Medi-Cal to actually pay Planned Parenthood a rate that they were not losing money on abortions, that would be great. They haven't increased these reimbursement rates in a really long time. And this is a policy decision. And same with insurance coverage rates. A lot of private insurance does not cover abortion. Things that I would encourage donors in this space to really resist doing is to really resist feeling the need to reinvent the wheel. And this is like particularly like a San Francisco, Silicon Valley entrepreneurial thing, right? We all have really good ideas. We're all founders. We're all entrepreneurs. We all want to start something. We actually have really good infrastructure. Our clinics are really good. Our directors are really good. Our abortion funds are really good. We have good people on the ground. We have good networks. They're there. They're underfunded, but they're there. And so I would encourage people to not think that what we're missing is another new organization, right? And to really look at the infrastructure that's there and figure out where you can invest right now. I would also really resist the idea that like what we need is like new underground railroads to like get women out of Texas and like into California or into Illinois. And, you know, we have those, they are abortion funds and they've been here for a long time and they're wonderful. And volunteering with an abortion fund when I was in graduate school was like some of the most rewarding volunteer work I've ever done. And they're great. And we have a fantastic one here in Northern California too. And they do all the work of helping women get to California, of finding them housing, of driving them to appointments, of helping them figure out childcare, of, you know, like all those logistics, helping them get appointments, helping them pay for their abortions. They have good relationships with the clinics. A lot of times abortion funds have relationships with clinics that they can get discounts, right? With those clinics, that those clinics reserve for patients that are working through the abortion funds. So these are, like I said, the infrastructure is there. Like we don't need to go be starting new things in place here. And then the last thing was to really lean on stigmatizing ideas about what illegal abortion is going to look like, who's going to need it. Because I think we need to open ourselves up to new possibilities of what this future of reproductive freedom is going to be. So those were my thoughts. And I did have one other one that I added that I was thinking this morning. And this is not really a new funding idea, and hopefully it'll feel like low-hanging fruit to some of you, because I know that there are a lot of people that are really active on this call and that support a really wide range of progressive and political and advocacy organizations. Is like, take your top funding priority organizations and like go and look on their social media and look at the emails that they sent out today and just see if it was like business as usual for them, or like see if they were talking about this, right? And see if this was on their radar. And not every organization needs to be talking about abortion all of the time. But if you're particularly looking at an organization that's doing like, you know, voter mobilization or organizing or turnout, particularly in these states that are going to be most impacted, especially in the South, right? Like, what are they doing if they're not engaging with this, at least today, right? Today, when this case is being submitted. I do think that as much as we would like to blame the right, and we can and we should blame the right for this, a lot of progressive organizations do not and have not talked about abortion because of stigma and because they're uncomfortable with it. They don't know how to message it. And, you know, otherwise excellent organizations that do phenomenal organizing sort of leave reproductive justice out to the side. And if you have good relationships with the leaders of these organizations, you know, give them a nudge, let them know that we're in a crisis moment, and ask them, how can you include this in your messaging? How can you think about this in the work that you're doing? How can you talk about this with the people that you're organizing? And if you're uncomfortable with it, if you don't know how to message this to people, like, who can we connect you with? Who's doing this work on the ground in your state? Because we need everybody to be talking about this in some way. This is going to be a crisis, and these issues are all intersected. And you know, as someone, I have always worked in abortion, and I always use the word abortion, and I always talk about abortion. Someone's like, you say the word abortion a lot. And I'm like, I don't even notice it anymore because I do, right? But I think that we need to push our own partners and our own organizations to be figuring out how they can talk about reproductive justice in their work. It is a criminal justice issue. It is an environmental justice issue. It is an economic justice issue. This is an issue of safety. This is an issue of families. This is an issue, like, this is core to people's freedom, and we're going to lose it. So what are we doing if we're not talking about it today? So those are my thoughts. I would love to have a conversation. I'm happy to share some of these organizations that I'm really proud to support, and looking forward to the conversation.
Thanks, Gretchen. Hi, everyone. I'm JM. I'm another senior philanthropic advisor here at the foundation. We really appreciate you, Gretchen, sharing so many thoughts off the bat, and I'm sure there are many other questions that folks are having. So you have various methods to send a chat to me, the moderator, or you can put a public chat with your question. I have some in the queue already. And if you would like to, you could also go to the reactions tab, raise your hand, and we can unmute you to have a real-time conversation. So feel free to keep those questions coming in. So to get us started, I know it feels like a heavy day. I could definitely hear that in your voice as you started, Gretchen, and it was just reminding me this morning of that, that sense of dread I think many of us probably felt when we heard that RBG had died. It was kind of like in anticipation of a moment like this. So it is a very emotional day. And I want to, maybe start on a more emotional tone and like take this in a personal direction. So much of giving, philanthropy is it's about like our personal passions. And I'm curious about what your bio doesn't tell us. What motivates you to make this a central focus of your work and of your giving?
Yeah, I mean, so I have always been very clear that this has been a priority for me, right? Like I think part of me has always felt like I was always fairly comfortable with this as an issue. And because I know so many people are uncomfortable with it, well, then this was the work that I had to do, right? Like that I kind of think that we should all be doing the most radical work that we feel comfortable doing. And so that for me, this was it. This was something that felt very intuitive to me. And my scholarship is actually a lot on adoption and teen pregnancy and young parenthood. And so looking at reproductive justice from different angles and sort of like how we frame parenthood and other types of stigmatized reproductive decisions. And, that's always been very compelling to me, like how these narratives are the same, because the people who are restricting abortion, they're not just like, they don't just want people to have babies. It's really just like a very heteronormative idea of like the acceptable family. These very regressive ideas of who they want having children and when, on what timeline, and how they want children raised. And so this is just something that has always been comfortable. And honestly, a lot of the organizations that are on this list, I've been funding them since I was in graduate school, and I was living in Boston on a $15,000 a year grad student stipend. And I was really, really proud of my $50 annual check that I wrote to the local abortion fund, and I still fund them. And I'm still really proud of that work. That was the right organization to fund then. It's the right organization to fund now. And so I'm glad to have a relationship with them, and I've always been clear that that's this is the work that is the focus of my philanthropy. So.
Thank you. I want to maybe go in a direction of this, so being a focus for you, and you mentioned toward the end of your comments that, you know, this issue is also a criminal justice issue, it's an economic justice issue, it's a health issue, it's a families issue. And I am thinking of the Audre Lorde quote where she talks about there's no such thing as a single issue struggle because we don't live single issue lives. And so I wish, or I would invite you to just unpack a little bit more of the intersections between, you know, the state we're going to be living in a post-Roe, whatever formulation that takes, and other issues that people care about, and kind of connect some of those dots.
Well, I think what most people don't realize, and most people on this call might, but when I say most people, I mean like most Americans don't realize, is that most people who have abortions are already parenting, right? They already have children that they're raising. Most people who have abortions in this country are women of color. Most people in this country who have abortions are living in poverty. And so already, like just from those like really simple demographic facts, you're looking at people who are making this decision as one in the context of like, how am I going to get through the day caring for these kids that I have, right? And that is a very different idea than what most people think of when they think of someone getting an abortion. And I don't think that that's not how we understand abortion care, right? Like we have this idea that people make this decision quickly, they make it flippantly, they make it late in their pregnancy for no reason. And I think that that's not the reality of what care looks like. I think it's much more nuanced than that. But I think that it is, there's another quote, and these quotes sort of end up as orphans because they get repeated in the movement so much. So I can't actually tell you who said it because I've heard it from so many different people, and I've tried to find the source. But it's that there are not mothers and women who have abortions. They are the same women at different points in her life, right? And this is just something that impacts all of our families and all of our communities, even if it's not surfaced for everyone at any individual point in time, right? And the ways that all of our families have been impacted by someone who's had an abortion, either in our past or in our extended family, or right, like that this has changed the size of our families, the order of our families, the timing of our families, you know, and I think that that's meaningful. And the timing of our careers, our ability to finish school, right? Like the degrees we're able to complete, the money we're able to make and save and invest and give, like this is the freedom to determine if and when you have children, and with whom, and is essential to shaping the rest of your lives. And in that way, you can't isolate it. So to me, this is the work. So
Thank you. I put a link in the chat to the Give Guide that you shared, these organizations that have been really kind of core focus of yours. And we're definitely getting questions about how to focus giving, and this is a philanthropic audience. And one of the rays of hope I heard in what you were saying was that there's already great existing infrastructure to fund in this fight, whatever it looks like going forward. So I'm hoping that you can both unpack the different types of needs. It sounds like, there's clinics who are going to be running on really small margins. There's women who need direct support to travel out of state, or, there are so many different types of needs. So can you kind of quickly organize the types of needs that are out there? And then also talk about where donors might want to focus in order to make a difference. So certain donors might be interested in meeting certain types of needs. There are also questions about, is it better to donate to a brand name national organization versus some other more local, or how do we know what to fund?
Yeah. So first, if you are a recurring annual donor to the Planned Parenthood Federation of America or NARAL, or I saw someone asked about the Center for Reproductive Rights in the chat, or any of these organizations, you should continue your giving and you should feel quite good about it. That being said, those organizations are quite well funded and will not go underfunded, right? And CRR in particular, CRR is the primary legal arm of the reproductive rights movement. Their attorneys were the ones arguing the case this morning. They do excellent work. They have huge amounts of foundational support. They have a lot of money, right? And so a lot of the organizations that I have, yes, CRR is the Center for Reproductive Rights. The organizations that I have tried to include in the Give Guide are organizations that are smaller budget, where your $10,000 is going to make a big difference. Your $50,000 is going to make a huge difference. Your $100,000 is going to be really transformative for them, right? Your $100,000 to CRR, you are going to get a really nice letter from Nancy Northrup, and they will be very appreciative, and they will do good work with that, and you will feel good about it, and good. And I'm not trying to take that away, but I just think that it's time to be a little bit more. I think that what we're facing right now, we need to be a little bit more creative with moving money closer to the ground, closer to the people that are going to be in direct service. That's my inclination. That's what I have chosen to do. So, but I know a lot of people who give to CRR, and like I said, I think you should feel good about that too, because we do need lawyers. So, yes. So, I mean, I think I'm trying to, where's the gift guide? I got some tab open somewhere here. Yeah. So the scope of what I tried to do here is a lot. I put a lot in here. So I think the first bucket, if you will, is the National Network of Abortion Funds. And that in and of itself is a bucket, right? And you can give to the National Network of Abortion Funds, and they support abortion funds all across the country. You can also give to individual funds. So our individual fund here, and I should say I made a mistake here. It says Access Women's Health Justice. They've recently rebranded and changed their name. It's actually Access Reproductive Justice now. So if you're Googling, just that note here. Our local fund, they do fantastic work here. You can also, I know a lot of people gave to like the local Texas abortion funds after the SB 8 passed, after the Mississippi law passed. Like, so many people gave to the Mississippi funds that they bought the clinic in Mississippi. right? And so that's great. I mean, that's like they did phenomenal work. Another way that you can think about it, I knew people would be flooding the Texas funds with donations. I gave to all the New Mexico funds, right? New Mexico has fantastic abortion laws. They have one of the latest gestational age limits in the country. They are making investments to build clinics closer to the Texas border. And so I decided to give money to some of the really good funds in New Mexico. Because I knew that that money would actually go to helping the influx of patients that they'd be absorbing from Texas, right? So really, I want to assure you that any money that you give to any abortion fund is going to be going directly to helping a person who needs their abortion get that abortion. And really, you should feel good about sending it to any fund. And if you want to direct it to here in Northern California, if you want to direct it to your home state, if you want to direct it to one of the states that's facing a crisis because of the lawsuit, then you can do that. I think this would all be important. And I am paying attention to like the border states, right? So New Mexico is important. Florida, for as long as it lasts, will be important in the South. If we can keep Georgia clinics open, Atlanta will be really, really critical. If we can keep Tennessee open, Memphis will be really, really critical. These are bigger ifs. Like New Mexico will be fine. Like New Mexico will stay open. But the funds are also networked, right? So like if the clinics in Texas close, like that money will still go to people that have to travel outside of Texas. So abortion funds just do phenomenal work, and that's direct service to helping people get their abortions. I also put in iNeedA, which is a website. Basically, you go in, you enter your age, you enter when the first day of your last menstrual period, and you enter your zip code. And it brings up like all the relevant laws. So like if you are 17 years old and there's a parental consent or parental notification law in your state, it brings that up. If you don't want to go through parental consent or notification, it brings up the process for judicial bypass for that. And then it brings up a connection to an organization that will help you navigate the judicial bypass process. It brings up the approximate cost of an abortion in your state or your zip code. And if you need an abortion fund, it'll connect you with the abortion fund. It'll bring up the local clinics. It'll tell you what gestational age they go to. It'll give you links to the clinics. It'll give you links to, if you live in a state that can provide telemedicine, it'll give you links to that. It's just a phenomenal online resource. It is like the smallest, scrappiest little online team that was started as like a passion project. And they do a really good job of staying on top of laws. So if you just want to make people have a really easy time finding the information that they need in a really rapidly changing legal environment, I just have a lot of faith that they'll make it easy for people to find what they need to get their abortion. SAS, which is self-managed abortion, safe and supported. This gets into helping people have the information that they need about taking abortion pills on their own. They don't distribute abortion pills without medical supervision, but they do make it so that people have the information about what the pills look like, what the dose looks like, what side effects they can expect, how long it takes, what amount of bleeding they can expect. This keeps them safe medically, but it also keeps them safe from criminal prosecution. So one example I give is a case in Pennsylvania. There was a 16-year-old girl who was pregnant, and she went to her mom and told her mom she was pregnant and she wanted to have an abortion. And her mom went online and was trying to help her daughter get an abortion. And without even really realizing it was illegal, realized the clinic was really far away and she couldn't get there. And this Google ad popped up for pills, and she just bought them online. They arrived. Her daughter took them. She was bleeding quite a bit because the abortion pills essentially induced a miscarriage. And her mom took her to the emergency room. She did not require treatment. She just required observation because she was fine. But they just didn't know what to expect medically because they didn't have any information about this. She was observed for a few hours. They sent her home. But her mother had done what you would want a mother to do, which was be honest with the doctors about what she had given her daughter. And the mother was arrested. And so what you have here is a situation in which the daughter was medically safe. The mother was trying to take care of her daughter, help her end this pregnancy, which is exactly what her daughter wanted. And they have exposed themselves to criminal prosecution because of lack of information about how these pills work and what to expect. So what SAS does is basically give people information about what they can expect if they are using these pills on their own.
Thank you, Gretchen. I'm gonna, if I can, like, pause you there because we're gonna run so short on time.
I know, I'm sorry.
I love the in-depth kind of strategic perspective you're giving about the different types of support that donors can provide. And I am noting the questions that have been chatted that we might not get to specifically. We'll make sure we get, we'll interface with Gretchen and get you an answer. Maybe for my last question before we just wrap up, definitely feels like you've mentioned some specific states where donors might want to focus. You've mentioned the place to go to locally if people want to support locally. Where this fight goes next, and I know that that's a hard to answer question just given the various forms the ruling might take. You've mentioned messaging fights, federal legislation, state policy fights. We know that certain lawmakers will stoop to like new lows that we never anticipated being possible. What do you see as like the frontier or the next thing for donors to be, educating themselves of being aware of and ready to lean in supporting?
So I think that culture change is going to be really important, right? And figuring out how to like inform minds and change hearts on this issue and build consensus around what this means. There are a couple culture change organizations in the gift guide as well. And then I think more really any systemic political change is going to be about building power here. So I also did include things on court expansion. I think that that's important. I included the 501c3 Take Back the Court Foundation. There is also a lot of 501c4 political advocacy work to be funded here. I know we're not talking about that on this call, but for donors in that space, there is a lot of work to be done because these recommendations are all C3 recommendations, obviously, but this is a political fight at the end of the day. And so I think donors should also be equipped to use every lever that they have when they are considering what they can do.
Perfect. Thank you so much, Gretchen. That's, I think, the perfect note to cap this off on. And I'm going to pass it over to my colleague, Allie, to close us out.
I just wanted that I'm going to put my email, if that's okay, in the chat if folks have any questions. Is that all right?
Please, that's great.
If folks have any questions about the organizations in the Give Guide or anything I've said, please do feel free to reach out. I'm happy to talk about this. I talk about this all the time anyway, so happy to talk about it with fellow San Francisco Foundation folks.
Thank you, Gretchen, so much for sharing all of this great insight. Just your unique perspective, I think, provides us all, this community, with this opportunity to really dive into the deep end and be much more strategic with our giving. So, so appreciate your taking the time. And for all of our guests, thank you all for being here and learning and being willing to commit to taking action and doing everything we can to defend reproductive freedom and access. You will be receiving a follow-up email that will have some highlights from the conversation today, our Give Guide, a very, very, very short little feedback questionnaire just so we can keep improving and finding out what else you want to talk about. So with that, I'll leave you, and again, really appreciate being in community, everyone.